Thank you for the kind invitation to be a part of this very well designed session. This is a topic given to me. Can the entire slide come in? Okay, roadmap to growth and staff retention. And all of us is used to investing on equipment, instruments, reinvesting, renewing them, sometimes even unnecessarily, all to take care of these 2.4 millimeters of that's under our domain. But what we need to concentrate is the team which is going to put all these instruments to use. I often believe that no general can fight his battles alone, and whatever you have achieved as a team, however big it is, it's whether it's a 4-member team or it's a 1,000-employee institution, is all because multiple people have performed their roles optimally. And I believe the strength of any organization lies in getting this team together rather than the infrastructure, the equipment that they acquire. Once they have a team which is responsive, which shares the vision of the leaders, then obviously that organization is going to make it. So, what are the measures? I'm going to talk only from practical experience. Obviously, there are several other ways of doing it. And we have the way we control our different centers is to have one Zoom meeting with all the principal stakeholders, which is the senior consultants, the medical director, all the senior professionals who are working there, where all the working of that particular center is threadbare discussed. All the numbers are shared with them, and in case it's doing well, there is a certain amount of compensation that's offered to them as an incentive. It may, depending upon the level at which they are in that particular organization. We also have an idea about what exactly was the turnover the previous year, what is our target this year, exactly the same month, because it's a month on month which comparison, which is usually looked at, and then what exactly we achieve at the end of the month. And obviously, this motivates the team. The one hallmark we emphasize is that do not cut corners to achieve these targets. Whatever you are doing is to be ethical in the best interest of the patient. Again and again, in more than 30 years, I've found that any shortcuts, obviously, in the long run doesn't work out. And constantly working to enhance your reputation, enhance your skill sets, and what you're offering to the patients is what finally matters. And that's the message we want to get across the entire organization. It's not just the consultants that you matter. I'm just taking a section of the optometrists across our different centers. These are the groups of them. Depending on the size of the center, the numbers also vary. And these are the pictures of them. Even at this level, even though some of them are youngsters, 18, 19-year-old, reward, recognition, and respect for the contribution they do. We often keep emphasizing that success of the organization depends on their work. It's not just the optometrists, but each and every segment of the staff that obviously motivates them to perform and give off their best. So it's not just the monetary compensation that matters, but even recognizing what they do, giving them also an opportunity to perform, in the sense that this is the 12th edition of the clinical refresher course. Almost all the slides and pictures I'm sharing is what we did in the last year or so. And this is an extremely successful conference for optometrists. All the speakers in this are our own consultant optometrists, and this is attended by more than 500 optometrists. This is the time when the fellowship certificates to those who have passed out, and the best outgoing student is also recognized. And they really look forward to this. And the fact that the professional development opportunities have been given to them, and it's also recognized, integrates them, gels them with the organization. And when we did a phaco-refractive decoded conference, though we had eminent national faculty, excellent surgeons visiting us, all the 15 or 16 surgeries were performed by our senior and mid-level consultants, and essentially the visiting faculty acted as efficient mentors. So recognizing the skill sets of our own staff, giving them an opportunity to showcase them allows not only skill development, but also recognition for the same, which is extremely important. It's not all work and play. And I often consider that whenever you can get together to have a game to play, you will also work harder. This is one of our last year's annual consultants get together. A section of them are seen in these pictures. And it's not just the consultants who matter. These are the lower level employees, the receptionists, the sisters, etc., who went out on a holiday. All of them are given time off to do that. And it's not just individual centers which go out, but even across centers, they are allowed to interact with each other. Emphasizing a work-life balance, and it's extremely important to make these youngsters feel that not only working in the best place possible, but it allows them to express themselves, and safety is paramount for all of them, and nothing which is compromised on that is tolerated in any way. So just like the organization wants to progress, they have goals. Each and every individual, whether it's a driver or a ward boy, looks forward to growth in his professional lifetime, in his while he's there with you. And unless he or she sees a growth pattern, they are not going to they are not likely to last with you. Basically, each of them is given a clear career progression paths depending upon the capabilities. Internal promotions is what is constantly encouraged. Somebody who joins about 15 years back as my EDP coordinator at a 4,500 rupees salary is my general manager across centers now. And they are mentored, handheld leadership roles are offered to them, and we minimize to the extent possible lateral entry. Though if the position demands it, we do go ahead and do that. Make the organization entirely acknowledge the fact that this person is going to add value to it. And whenever somebody, whether it's improving the English language skills or computer skills or just communication skills, we assist them to go ahead and do that. And it doesn't come without any assessment. Obviously, there are all kinds of people in your organization. And then evaluating them periodically, whatever in a large organization, a structured evaluation like what we follow on a 6-monthly basis is there. And it's not that every raise is automatic, but we evaluate them depending upon the feedback given by the center head, the people whom they are directly reporting to, and subsequently decide whether they get a 20%, 10%, or a 5% hike, or even whether they are retained in the organization. We got a importance of social media, which just covered so nicely. We got a Google review of more than 10,000 for our principal hospital at the Google score of 4.9. And this was a moment to celebrate. And we just got together a small get together. And this, our patient care coordinators were encouraged to cut a cake and celebrate in front of the entire hospital. And obviously, this was a motivation. There was some monetary incentive, but recognizing what they did is also extremely important at each and every level. I am sure all the organizations in their place have certain events which promotes congeniality. The families are also brought together. These are team building and social activities. Obviously, once they connect with each other, they also tend to perform much better. As I said earlier, these are my two principal doctors, Dr. Ravi and Dr. Shrish, right in front, who have been with me for more than 20 years. And Rajiv Nair, whom you see in the third photograph, is from Calicut. He has been with me for more than 30 years, and he came from Shankar Netrale after his BSc optometry. And what you see over here, unfortunately, the cursor is not working, is my driver who's there for 30 years. He manages a fleet of cars now. Obviously, he is more like a manager now, and his position in the organization is also being recognized. Once they have spent a significant amount of time, all the retirement benefits, long-term bonus, etc., is also taken care of. This is not only done to make them feel happy, but also make the employees who are remaining with you feel secure and feel that this is a good organization to work with, who are going to be taking care of you in the long run too. And finally, we lay a lot of stress on keeping yourself fit. And there is a Coimbatore Marathon that's held every year. This year it's on December 18th. We sponsor whoever is willing to, whether it's 5 kilometers, 10 kilometers, or 20 kilometers, they're gone ahead, they're sponsored for the marathon events. We also have places to work out. And obviously, fit mind needs a fit body, and that's something that we encourage. And these are also great ways to network and promote the organization as a whole. These are some tips that I have shared, what we do in our particular center. Obviously, there are various other ways of doing it, and we have evolved these things over a period of time. I hope this did resonate with what you do. Thank you.
Thank you, Dr. Ramamurthy. Lights on, please. It was a wonderful talk because it is not just a theory because of your extensive experience. Actually, most of us need to learn from you. And very, very happy to have you here. So please accept a memento from KSOS side from Dr. Sachikumar. And actually, the next talk is by Dr. Basin. He is the. Thank you.